Pregnancy is the most fascinating thing in a woman's life. It carries a lot of memorable moments. The menstrual cycle varies for each woman and it can vary each month also. So there should be a menstrual calendar maintained, and if you feel you have crossed your period, some people have very short cycles like 25 to 28 days. So depending on that, at least 3 days later than the expected period, it should be checked. The testing of pregnancy differs for each person according to their previous menstrual cycles. If somebody has missed a period because of some medication they had consumed in the last cycle, or because of stress, or because of some illness, that is very difficult to differentiate. If there is a missed or a delayed period, it has to be tested. So if it is negative, then next thing we have to think about other medical problems which can cause a delayed period, like a thyroid issue or a previous illness or medications or recent travel and stress. Some experience low abdomen cramping or leg cramping. Some only experience extreme tiredness and weakness, lethargy. They always feel like sleeping. These might be the very common symptoms. Some it might be breast pain also. There are 3 different stages of pregnancy. So first 12 weeks is the first trimester, and then up to 28 weeks is the second trimester. After completion of 28 weeks up to the date of delivery, it is 40 weeks, it is third trimester. Weakness, tiredness, nausea, vomiting, upper abdomen pain, lower abdomen cramping, and a lot of acidity, and even back pain. Back pain can happen in the first trimester as well as in the second trimester. By the time the woman goes into the second trimester, the abdomen size starts increasing. By the 5th month, they experience the movements of the baby. It's like some butterflies in the tummy. That is how they feel around the 5th month. Third trimester, that is around the 7th or the 8th month, that is after 28 weeks, the movements of the baby is very distinct, and they can easily make out. You can even observe the movements of the baby. I would advise to avoid spicy food. I advise you to have more of homemade food, because we like to avoid preservatives and food additives in the first trimester. Radiation is to be avoided, that is in the form of X-rays or CT scan. Only if there is an absolute need, it should be undertaken. And women should avoid strenuous activities. Normal activities and whatever activities which you are used to can be continued, but anything strenuous or which will make you exhausted should be avoided. There are a lot of changes that a woman undergoes during the pregnancy, not only physically but also emotionally and mentally. Because of the hormonal variations, there are a lot of anxiety issues in women and a lot of mood swings. It takes a lot of understanding for the husband to understand that the woman is behaving in such a manner because of her pregnancy condition, not because she is doing it purposefully. Women also can undergo a phase of depression during the 3rd trimester when they're anxious. What would be the outcome of pregnancy? Like, how will I deliver? Will it be a normal or a cesarean? If I am having discharge now, will I deliver prematurely? After pregnancy, also post-delivery, many women go through the postpartum blues, a depression phase, because the estradiol and the progesterone hormones suddenly dips after delivery. Many women are worried how my pregnancy is going to go. Will there be a problem? Many women are anxious regarding that, and they repeatedly question the doctor what to do, what not to do. So there is no need of being anxious. Be normal as you can. Follow the precautions given by the doctor. Eat small frequent meals. Have a bland diet, healthy and a high protein meal with more of fruits and vegetables. It is advisable. So it's better to lead a normal life rather than be anxious and restrain yourselves.
With over 1 lakh medical experts and the facility to teleconsult, experience clinic-like consultations on Practo.